This segment of Delmarva Life is brought to you by Delmarva Dental Services.
Are you afraid of the dentist? A lot of people are. Maybe it's the potential for cavities that keeps you away. Maybe it's the fear of the unknown.
Take all of those feelings and toss them. The staff at Delmarva Dental Services puts patient education and care at the forefront of their practice, all in an effort to put you at ease. 102.5 WBOC's Leah Rizzo hung out with the crew to talk about the importance of trying to save your teeth instead of having them pulled if there's a problem.
It's not uncommon to be more than a little apprehensive about a visit to the dentist. Sometimes so much so that people avoid their regular cleanings altogether because they're afraid. At Delmarva Dental Services, educating patients so they have the tools to make the right decisions about what's best for them is the primary focus of the team. Many dental problems start off as cavities, but cavities don't just appear out of nowhere.
There has to be 4 different things that come together in order to have a cavity form. So first, you need a tooth. You need a susceptible host, and that's the tooth. You also need bacteria, but not just any kind of bacteria. It's the bacteria that forms decay, and it needs to actually have the food or the source, which is our substrate, in order to chew it up and then go into the tooth to break it down. So that's where the sucrose and the carbohydrates come in and break down in order to cause the cavity. And then lastly, we also need time. We need the amount of time to pass for the bacteria to come into the tooth and break it down.
Dr. Sikelis understands that sitting in the dentist chair can be frightening, but at Delmarva Dental Services, they emphasize patient education to make sure you're comfortable every step of the way.
I'm here for the patient that is nervous. I'm here to explain to them that we can get over that hurdle, right? So education is key. Your patient needs to understand what is going on. It's the fear of the unknown, okay? It's the fear of losing control in the chair. So I'm here to help them get over that fear.
If you are experiencing tooth pain or sensitivity, you may have a cavity that's formed. And if it is a cavity they're dealing with, Dr. Sikelis emphasizes just how important it is to try and save that tooth.
Usually the reason patients don't want to save a tooth is cost, the fear of the dentist, or just not knowing what is going to happen. So that's where we go back to educating the patient, right? And being one-on-one with that patient and understanding. I think they have to understand what it requires to replace that tooth later, because there are options. So one option is an implant, where it is a titanium screw that is actually drilled into the bone, okay? And it does not come out at night. It stays there, and then we place a crown on it. It looks like a tooth, works like a tooth, okay? Aesthetically, we can make it match your other teeth, and it's a wonderful option. That being said, implants are pricey. They do end up costing more money than saving your tooth originally. Option 2, a bridge. A bridge is something that, again, stays in place, does not come out at night, but you do have to drill on the tooth behind it and the tooth in front of it in order for this to fit over there, okay? The important thing to talk about with this is that if your 2 teeth on either side of the missing tooth is in great shape, you've just now compromised those teeth. Now, there are certain cases where it's a great option because this tooth needs a crown and that has a really large filling. Well, that might be a wonderful option for you. So this is another option. Third option is something that comes out at night. This one in particular is actually a flexible material. Okay, so this kind of gives, there's no metal to it, so it is a little more aesthetic and our patients really like it. And it just clips around either side. And this is a wonderful option if in fact you're only missing one tooth. Then it's great to put that just in this area. It can be very cosmetic. You can eat with it, but you do have to take it out at night.
Those models, amongst others, are just some of the options and tools Delmarva Dental Services uses to educate patients so they can make the best decisions for themselves. They also use a tool called Casey Cloud.
So this tooth is pulled, and now we start seeing these teeth shift down, as well as giving spacing between teeth, causing food to impact, can cause more cavities. You see this tooth drop lower, causing an issue to your bite, changing all of that, and also causing pocketing of the tissue to form. So you can end up with periodontal issues where you come in for your cleaning and now you've got pockets in your tissue and infection and inflammation there that we need to address.
The emphasis that Delmarva Dental Services places on patient education is the real first step in making sure patients know how to keep their teeth clean in hopes to prevent cavities and other dental problems. If you do, however, have more serious dental problems or do need a tooth pulled, it's important to know that not only is Delmarva Dental Services on your side, they'll provide you with options as well.
Just goes to show you education really is key for feeling more comfortable in the dentist chair. For more information on Delmarva Dental Services and all that they provide, go to delmarvalife.com.